What is a dental prosthetic? Years ago, when we started dentistry from Egyptians, we were doing dental prosthetics just for function. For to eat, for to speak, and for the muscles also. But in the new generation, after 50s maybe, there is something included also. It is aesthetic. And nowadays we are doing prosthetics for the aesthetics. Generally, we can say there are two ways of doing a prosthetics. One is the old-fashioned way. It is the movable prosthetics. But we are generally, or we are especially trying to do them now fixed. So the second prosthetics way is the fixed prosthetics. And now when we are talking, so I don't want to talk about movable prosthetics. When it is an issue and there is nothing to do, we use movable prosthetics if there is no more option. But now I'm thinking there are no more option, for to say no more option. Because even if we have to do a movable prosthetics, there are some zygoma implants for us, which are helping for to fix a movable prosthetic. For the fixed prosthetics, I can divide them to three because it is depending on aesthetic and unaesthetic. But I don't like it saying like this because I believe that every prosthetic, the best prosthetic is the best matching with the patient. So we have metal prosthetics and we have non-metal prosthetics. But I always believe that there is no best prosthetics type. We just check the patient, we understand everything. We look to the muscle, we look to the face, we look to the attitude of the patients and the closure relations, the articulation relations, and then we do our plan. So, any case, if you want to divide them to two, it is metal and non-metals. I think you generally want to hear about the non-aesthetic prosthetics. So we can say, when we say non-metal, there is no non-metal also. It is zirconium prosthetics and the Empress material. It depends on which material you are doing. At the end, the metal, the zirconia, and the Empress prosthetics or the zircon or the ceramics, they are all fixed prosthetics. So the material changes the type. If we talk about fixed prosthetics, we need power, strengthness, and we need aesthetic. When we are planning a prosthetics, we are looking only for these two. So for the power, we use metal or zirconia as the base. And for the aesthetics, we use ceramic. Even on the metal, we put ceramic. Even on the zirconia, we put ceramic. Or if we are doing something which is called without a framework, like with the generally known name Emax, we use reinforced ceramic. At the end, there is no best prosthetic material. There is only best match with the patient and with the material. So you should leave yourself to your doctor.